As health challenges evolve, Nigeria is ramping up its efforts to combat HIV, tuberculosis, and malaria. Central to this push is the country coordinating mechanism CCM, which ensures transparency and effective implementation of global fund-supported programs. At the 2025 CCM annual retreat held in Lagos on Tuesday, government officials, civil society actors, and private sector leaders convened to discuss key priorities, including improving grant performance, enhancing legislative oversight, and securing sustainable health financing aligned with national priorities. TV366's Queen Ibanigo has more on the story.
With international funding steadily declining, Nigeria is now charting a new path with major focus on long-term solutions to protect and strengthen its public health systems. This retreat signifies a strategic transition from donor reliance to enhanced domestic accountability, sustainability, and government-led health initiatives. Senior health officials, including Director General of NAFDAC and the Commissioner for Health of Ekiti State, reaffirms their commitment to the transparent and effective implementation of health programs.
NAFDAC in particular, and in alignment with national objectives, has participated in targeted activities under the grants, particularly in areas such as laboratory systems enhancement, traceability, implementation, pharmacovigilance, and quality monitoring of essential health commodities.
We've received, we heard from the Global Fund, over $4 billion that's coming to the country. But we've also seen some impacts. HIV prevalence has come down significantly. We're seeing higher cases of TB being detected. We're seeing many more commodities being available for malaria and people being, diagnosed first with RDT rather than clinically. So there's a lot of work that has happened, but there's a lot more that needs to happen.
We are also observed, and then we have seen that the government is fully committed and then minimize the impact. We have seen that optimizing the campaigns, strengthen the primary health care, that leverage the alternative funding, and maintain the essential services.
For the first time, the retreat led by the Minister of State for Health and Social Welfare, Professor Ali Pate, fully interrogates participation from all levels of government. Officials at the country coordinating mechanism describes it as a moment in the nation's approach to health financing. They underscore the urgent need to reduce the out-of-pocket health expenditures and to ensure that the vulnerable and insured populations are not left behind.
The CCM, working with the Honorable Minister, has started working on what we call the SWAP, the sector-wide approach, which means there is an intentional, systematic collaboration and coordination between all funding streams in Nigeria, so that we are achieving maximum optimal benefit for every naira spent.
Collaboration has worked. For malaria, it drops from 42% to 22%. Then for tuberculosis, our case identification and notification has improved significantly to the extent that last year, 2024, we were able to screen and detect as well as place on treatment over 400,000 patients in Nigeria.
Beyond serving as an annual review, this retreat serves as a reaffirmation of commitment to bridge funding gaps, meeting nation and global health obligations, and building a robust and resilient health system in Nigeria. Queen Ibanigo, TV360 News, Lagos.